First, we are dealing with onychomycosis. Onychomycosis is a fungal infection of the nails, typically affecting toenails more than the fingernails. It causes the nail to become thickened, discolored, brittle, and sometimes it's become painful. Causes dermatophytes, most common fungi, and yeasts like candida, non-dermatophytic molds. Symptoms which are include nail discoloration, which may be yellow, brown, or white discoloration, thickening and distortion of the nail, and crumbling of edges or brittle nails, as you can see in the picture. Separation of the nail from the nail bed, onycholysis, and sometimes the mild pain or discomfort also will be appearing. The major homeopathic drugs which we can treat onychomycosis is thickened brittle nails with a yellow discoloration, antimonium crude. Antimonium crude indicates the nail become thickened, brittle nail with a yellow discoloration, nail cracked or splitting associated with a rough, scaly skin around the nails. Graphitis, nails become thick, hard and ridged, sticky, using eruption around the nails. Slow healing with a dry skin. Silicea, nail brittle, slow growing, prone to infection, help to expel the pus from the infections. Weak, silicea which helps the pus from the infections. Weak, soft nails with the recurrent fungal infections. Merxol or Mercurius solubilis, nail becomes soft, brittle with offensive odor. Swelling or ulceration around the nail folds, discharge or pus formation. Arsenicum album. Arsenicum album, major symptom will be burning, itching and restlessness. Discolored and brittle nails and symptoms worse at night and from cold. Hepar-sulfur-calcareum. Painful, sensitive nails with a tendency to suppurate. Nails thickened and brittle. Skin around the nails inflamed and sore. And the other condition is ONYCHOCHIZIA. ONYCHOCHIZIA is a nail condition characterized by splitting or lamellar peeling of the nail plate, usually starting at the free edge, the tip of the nail. It results in the nail layer separating into the thin brittle sheets. Key features are nails split into layers or flakes and often peeling away from the tip. Nails become brittle and fragile, usually affects the fingernails more than the toenails. Can affect the one or multiple nails. May causes cosmetic concern and sometimes mild discomfort also. As you can see in the picture, how the how the nail appears like split nails or onychorhizic nail. And common causes: frequent exposure to water or chemicals, especially detergents and soaps. When exposure or contact is coming means it can be possible to appear. And the repeated trauma or mechanical damage like nail biting, manicure, which can also lead to this. Nutritional deficiencies, especially vitamins like biotin and iron. Dryness or lack of moisture in nails. Aging process also. Prevention and care: protect the nails from the excessive moisture and harsh chemicals by wearing gloves. Avoid nail trauma and biting. And use moisturizers or nails oils regularly. Thin, brittle nails that split easily. A person may be sensitive, emotionally sensitive, with craving for cold drinks. Nails may peel or chip. Graphitis, for nails that are cracked, dry and split vertically, often associated with a rough, dry skin or eczema around the nails. Calcarea calf, for brittle nails in people who tend to be overweight, chilly and sweaty. Nails may be soft, slow growing and prone to splitting. Lack defloratum. Nails fragile, thin and split easily. Useful when there is a history of lactose intolerance or milk allergy. Natrum muriaticum. For nails that are brittle and have white spots or lines, often linked with the emotional stress and dryness. Calcarea fluor for hard, brittle nails that chip or split at the edges. Scars and nails tend to be hard but fragile. Helps to improve elasticity and strengthen of the nail tissue. Useful when nails feel contracted or rigid. Calicarp, nail brittle and prone to peeling or cracking, accompanied by joint stiffness or pain. Person may feel chilly and sensitive to cold draft. Lachesis, nail brittle, splitting especially near to the cuticle. Often used people who tend to be jealous, talkative, or have circulatory issues. Helpful when nails are purple or bluish in color. Sepia. For the brittle nails with tendency to split in women, especially related to hormonal imbalance like pregnancy, menopause. Associated symptoms like fatigue, mood changes and sensitivity. Causticum. Nails are brittle, cracking or peeling, associated with the weakness or stiffness in fingers or joints. Helpful when nails feel dry and split vertically. Thuja occidentalis. Useful if brittle nails are part of a history of skin infections, warts, or vaccination side effects. Nails may be soft, peeling, or malformed. The next condition is nail psoriasis. Nail psoriasis is a manifestation of psoriasis that affects the nails, causing various changes in nail appearance and texture. It occurs due to the abnormal immune response leading to inflammation in the nail matrix and nail bed. Key features are pitting, small pinpoint dents on the nail surface, most common sign, and onycholysis, separation of the nail plate from the nail bed, often starting at the tip. Discoloration, yellowish or brownish spots beneath the nail, sometimes called the oil drop or salmon patch. Thickening of nails and it become crumbly. Subungual hyperkeratosis, buildup of scales or keratin under the nail. Nail deformity, nail become irregular and it's become crumbly. Boos lines, horizontal grooves or lines across the nail. Causes and associations are include autoimmune disorder causing rapid skin cell turnover, often associated with the psoriatic arthritis, may occur with or without visible skin psoriasis. Can affect the fingernails and toenails. Symptoms: pain or discomfort in severe cases, nail changes causing cosmetic concerns, possible secondary fungal infections due to nail damage. Graphitis for thickened, rough and cracked nails with ridges. Nail may be discolored or crumbly, associated with the dry, rough skin or eczema. Arsenicum album when the nails are brittle, discolored and painful. Burning or itching sensations worse at night. Anxiety and restlessness may be present. Calisulf for the nails with a yellowish discoloration and scaling beneath, nails thickened and splitting. Thuja occidentalis for nails, deformities with a thickening and ridging, helpful if there is a history of vaccination or warts. Nails may be soft and crumbly. Sepia, useful in women with nail psoriasis accompanied by the hormonal changes. Nail brittle with a tendency to split. Silicea, for slow growing nails that are brittle and prone to infections, help in expelling pus and promotes healing. Restox, when the nails are brittle with soreness or stiffness in fingers. Symptoms worsen with the rest and improve with the movement.